I am Dr. Saibal Moitra. I am a consultant pulmonologist and working in the field of allergy and pulmonology for the past 20 years. Presently, I am the medical director of Allergy and Asthma Treatment Center, now known as NCD Immunomedicare Private Limited, and the consultant pulmonologist and head of Department of Pulmonology at Charnock Hospital, Kolkata. Today, I would like to talk about the treatment of the allergies. We find, and it's a very common thing, and it's more common in our country, that the patient comes with some sort of the allergic problems. He or she might go to a pharmacist or a chemist, or maybe to any family members, and that family member or the chemist or the pharmacist who are self-declared medical personnel, to be called like that, they give some sort of tablets which are most commonly antihistamines. Patient take these antihistamines and the symptoms gets relieved. So the next day or the next month, again the same symptom patient again takes another antihistamines, the symptom gets relieved. Then the things goes on. Okay. So what happens is that, say after a period of say 3-4 months or 6 months, patient might have got repeated episodes of these allergic symptoms which have got relieved by the antihistamines. The load of the antihistamine medicines in the body has gone up. The allergies have not been adequately evaluated, and the patient, then what happens is their need for antihistamines goes on increasing. These antihistamines, they're a very peculiar drug in that they causes the relief of the allergy symptoms in a very short time. But these drugs is also known to affect the liver, affect the kidneys, and also have an important deleterious effects on the brain function. So these drugs are not to be taken that lightly, but they have to be taken under proper guidance by a medical personnel in the dosages in which he or she gives, and in only for the time in which he or she is giving the drug. And these drugs are only symptom relievers. There are a few antihistamines which have got some role on the disease progression, but those drugs are not all the drugs which is available in the market. So only in the proper combination, in the proper dosages, after adequate evaluation, if these drugs are taken, they are safe. And if these drugs are taken just like that, they can have deleterious effects and does not stop but rather hasten the progression of these allergic diseases. So this is one of the factors which is very important to be kept in mind. The next important thing is that what we have for the treatment of the allergic diseases. So one significant component is the allergen specific immunotherapy. So if we talk about allergen specific immunotherapy, these are actually the giving allergy shots or the allergy vaccines, which is only to be given under a specialist who has taken adequate training in allergen immunotherapy. And these vaccines or these allergy shots, they are the only treatment which is known to alleviate not only the symptoms but also prevent the disease progression and also bring in decrease in the medication use for that particular disease. But the important thing is that when a patient should be started on allergen immunotherapy, the patient needs to be evaluated thoroughly, and the patient has to be known that what allergen the patient is actually triggering the symptoms. If the patient cannot avoid that triggering allergen, and if the patient's disease is not under adequate control, then only the patient should be put on allergen immunotherapy after adequate discussion with the patient, because that's a long treatment. It usually requires treatment for 3 to 5 years. But if the patient is given proper 3 to 5 years treatment, this patient mostly becomes free of the disease symptoms, free of the disease is for which the patient actually came for the consultation. There are various guidelines which says that how to give an allergy immunotherapy. There are IACI guidelines, there are WHO guidelines, there is an Indian guideline also. But this guideline has to be followed strictly under the supervision of an allergy specialist who has actually got adequate training in imparting this allergen immunotherapy. And these allergy shots or the allergy vaccines, though it might look to be something which is very trivial, but it's not so. It is actually given proper dosages with dose adjustments depending upon the patient's response, with adequate dose escalation till we reach the effective dose, which has to be taken on a regular interval for a substantial period of time to bring about the decrease in the disease activity in that particular person. So as we know now that allergen immunotherapy is the only disease modifying treatment, but it has to be given in only judiciously selected patients in whom it is known and we can know that it will definitely cause a benefit to these patients. Apart from that, we have the other treatment for the allergies. We have now very good biological agents which is coming into the market. We have the anti-IgE, we have the anti-IL-5, all these molecules and newer drugs which has come up, but these biological agents has also been, these are quite expensive drugs, but they needs to be used only selected group of patients in which the disease cannot be controlled by all the other medications under a proper supervision of a specialist who is actually dealing with this kind of patients. So all this treatment requires a very good specialist care and especially a tertiary care facility where treatment can be imparted to the patient along with the adequate monitoring of the patient's condition and the treatment and part also. So as we know now, this allergies is not a very disease which should not be taken very casually or lightly, but if we can take this problem more seriously and seek the doctor's advice and also follow his or her advice, then only we can bring down the suffering which disease causes. So this causes the mortality for disease is not very high, but the morbidity or the suffering is very high. You can actually reduce the suffering only by proper treatment and proper monitoring of the patient suffering from these diseases. I hope you all found the topics in which I have just dealt with helpful and it will improve your knowledge base. If you want to know more, you can go to the particular sites, or you can reach me through the CareClues platform.